All right. Good morning, everybody. If you will come in and get your election sheets and find a seat. For those of you that are watching on the live stream, I will be online on the chat feature. If you have any questions that you would like to ask Michelle, please post that in the chat feature, and I will be happy to share those and ask those questions. Or if you need more clarification on anything, please let me know. We set the tables up this year instead of doing just the seating, so you could be able to sit and write and make notes of anything that you needed to know. But I'm going to turn this over to Michelle and get started.
Good morning, everyone. Okay, so how many were in my meeting last year? All right, so y'all remember I knocked my drink over like 5 times. So it's over there this year. And it gets challenging trying to hold the remote, a microphone, and my handout. So hopefully you can hear me okay. All right, I'm Michelle Sutter. So this, I think, is our 7th or 8th year doing presentations. And thank you to Elizabeth and the accounting team and the finance department. Definitely is always a work of quite the massive project to negotiate final rates, to decide on the plan offerings. We did go to market to see if there was any other rates that would be lower, but United came in, negotiated the renewal down. So we had a minimal increase this year, which was exciting. We've added a new plan for United to give even more options of choices, and then we're making some changes to the dental and vision that I'll go over at the end that I think you'll be really excited about. So at the end of the day, we were very happy with the package we could put together. I honestly could print out 10 pounds of paper for each of you, but everything you need to know about your employee benefit package is on HR Connection. It's live now. If you go on there, there's a tab that says Open Enrollment. Has everything you need to know about the plans that we're offering. If you want to learn more about United Healthcare, there's even a special tab on there that goes over everything with United Healthcare. So since there isn't major plan changes, my goal today is to go through some of the value-added services that you have access to as employees with the carriers so that you can take advantage of those in addition to your medical plan. Because some days if we're healthy and not using our plan, there's other services that we can really benefit from. So I'll go over those in the packet and they're all in order. So the first thing I'm going to do is I'm going to go over the medical plans because that's always the biggest question of how do they work, what are the changes. So United Healthcare as a whole is one of the largest networks in the country. So it's worked well. I mean, on occasion, you will run into issues without a network. We did have an issue here locally with the hospital and the anesthesiologist was out of network. We've worked through that. So now we have a solution that if you get a bill and it says it's out of network, call us because we know now how to fix it. But nationally, anesthesiologists are one of the practices that have decided that they really don't want to participate in networks because they can balance bill higher. So it's not just this hospital. We're running into that on a national basis. So if you run into that, call us and we'll help do the best that we can to facilitate those costs and to get the claims reprocessed as in network. They have 24/7 support through United, so they have health coaches and nurses. They have all the online tools. So if you're not already registered, I would highly suggest you register for their website, and I'll go over some other features. They even have where you can set up personal reminders to yourself of reminding you throughout the year of when you need preventive checkups. And then these are going to be the 4 plans, and they're highlighted on the front page of your handout. There really isn't a lot of changes. We did add a 4th plan, but I'm going to go through from lowest to highest. So you have your high deductible plan, which we currently have in place, so that will not change. We've added something called Primary Advantage, and I'll go over that in a moment. And then we have the $5,000 copay plan, and additional, the highest cost plan is the $2,000 copay plan. United Healthcare nationally, they updated what they call their certificates of coverage. So where you'll see changes this year is on the major things, like when you're hospitalized. There's a new structure of how they come to what your final cost out of pocket will be. And then also they're giving incentives of where you get lab work and major testing done. And I have slides that'll go through and highlight exactly how that'll work. So the lowest cost plans, and today I'm just going over what the most utilized services are, because if I was to hand out summaries for every single plan, it's 80 pages long. So it's a little long to cover in an hour, but there's copies of these on HR Connection. So if you're comparing plans, but you can go into HR Connection, actually compare plans, look at them. We're here all day, so you have questions, we can go over it. And the biggest question will be, okay, the plan that I'm on currently, does it still fit my needs for 2019? And then potentially consider looking to go to the new plan. So the HSA plan is the same exact deductible as we had currently. It's a $4,000 deductible. Once you meet the deductible, then coinsurance kicks in. This is, you have signed up for the master class, so I'm going to make the assumption that you know what a deductible is. If you don't, then stop me. The next class, I'm going to be teaching what every definition is going through the plans. With any of the plans, something that was put in with ACA is called your annual out-of-pocket max. This is your absolute worst case scenario. If you had a really bad year and everything, you had knee surgery, you had hip surgery, whatever the situation could be, and you had multiple charges, the worst that you would ever pay out per person is $6,500. And if you have a family, then it would be $13,000, and you all as a family would accumulate towards that. But the very first person to hit $6,500 on that HSA plan, then for the rest of the year you're done paying, and everything would be covered at 100%. So I always look at a medical plan, even looking for my children, my husband, he switched employers this year, so it changed our insurance, is I look at what the worst case scenario is to know, so if it really was a struggle one year, what would I have to pay out? Again, on the high deductible plan, everything applies to deductible. The only first dollar service is preventive care. So if you have the HDHP, which stands for high deductible health plan, then everything would apply to deductible. Once the deductible is met, some services are paid at a coinsurance level, pharmacy reverts to a copay, and all of that detail in every line item of what they cover by benefit in alphabetical order is in the summaries. The next plan is a Primary Advantage. This is the new plan, and you'll notice on the handout that on this plan only, I've underlined 5 of the services. And that's because, say if you're not to a point where you're comfortable having no copays, and that's what the HSA is, it's no copays, and some people like to have just that comfort of knowing if I need to go to the doctor, it's not going to apply to my deductible. Well, I would then look at the Primary Advantage plan. Primary Advantage is a new plan that United rolled out, and what they did is they put copays on the top 5 utilized services based on national trends. So if I look at services, most people always concentrate on the deductible, but really that's the 80-20 rule. It's only about 20% of us hit the deductible. The other 80% are using the everyday services. And they'll run a deductible report for me every year, and they did at renewal. And you were right on target. 20% hit the deductible, the other 80 maybe had a little bit, but nothing to the point where they maxed it out. So again, preventive care on this plan would be covered at 100%. Your physician visit would be a $30 copay, so see it's underlined. But on this one, the specialist would apply to deductible. Once the deductible is met, then it would be a copay. But a lot of you are younger, like half my age. You might not be going to a specialist, but likely would be doing most of your care through your primary. So every time you go to your primary, it's $30. But say if you do have to go to a specialist, you're going to pay that at a discounted rate. You're not going to pay $300-400 typically unless they're doing a procedure in the office. So here's a way to have a copay for your primary. You know your preventive care is covered at 100%. But then you also have a copay for virtual visits, which we'll go over that in more detail. You have a copay for urgent care, which actually is less than last year. Urgent care last year was $75, but United is seeing where it's an effective cost containment, where if you go to urgent care versus emergency room, so they've actually lowered that to $50. And urgent care is nice. I have children. I don't want to run to the emergency room if my son was in a play at school, jumped off the stage the night before the show. We were concerned that he might have broken it. So rather than go sit for 6 hours at the emergency room, I took him to urgent care. They did an x-ray. He was fine. They wrapped it in ace bandage and we were off. Much quicker, much less expensive, not only for the plan from a claim standpoint, but also my personal out-of-pocket. Now, emergency room, that would go to deductible and has a copay tied to it. Same with inpatient and outpatient on this plan. It would be just like any of the other plans where there's deductibles and your applicable coinsurance. The copay or deductible for this is a little bit lower. So this one is $3,000. And then the other copay they put in place is for pharmacy. So the pharmacy is $15, $45, $85, $125. So if you look at this plan and you look at the cost for an employee only, it would be $49.75 semi-monthly, so twice a month. And it would give you that comfort if you're not quite ready to go to no copays, of at least having it on the major services. The other two plans, so the $5,000 plan and the $2,000 plan, are just like currently. Now, if you're on the $2,000 plan, likely you'll stay on the $2,000 plan. There's just a little bit of change in how the hospitalization charge works and how the lab side works, which I have a slide that I'll go over. So again, you have 4 plans to pick from. No matter the plan that you pick, you have 100% preventive care. My advice on preventive care, and we'll go over on the slide, is keep that visit at preventive care so then all of a sudden you're not hit with a copay, and we'll go over that when I get to the preventive care slide. So again, we have the HSA option, high deductible plan, no copays until you meet your deductible. Then we have the new primary advantage plan, the Choice Plus 5,000, the copay plan that we've had for quite a few years, and then the 2,000 copay plan. If you're not already registered, I definitely encourage you to register for the UnitedHealthcare website. Of any website, I find it to be the most user-friendly. Having had United as a family, it's very nice to go on. You can do cost estimators of care. Once you're registered under your personal name and ID, then it'll do directories based on your zip code. You can go and look at your claims. It was very nice. Our second oldest, back be 10 years this year, was senior in high school, and he was diagnosed with cancer. We were on UnitedHealthcare. At that time, he was off at college, or he was at the end of his year, and then we went to college, so he had like tests that were overlapping. But I was getting all of the bills, and you get inundated with different bills because you'll get billed by the physician, billed by the specialist, billed by the hospital, billed by the lab. And I wanted to make sure I wasn't overpaying. And rather than me having to keep an Excel spreadsheet, you can go right into the claim side and export an Excel spreadsheet, and it tells you exactly what bill charges were, what the discounted rate was, what the plan paid, and what I owed. So then I knew if I was getting an incorrect bill, it was right on that spreadsheet. I would go over, look at it, and I actually find it easier than even reading an EOB. So it's a great website. They have wellness tools on there. So I definitely encourage you to log in and set up your credentials. The preventive services. A lot of questions I get is, well, what does preventive mean? Well, it depends on your age. So there's different preventive care that we have as we get older. So at age 40, we get mammograms. At age 50, you might need to get a colonoscopy. But if you have family history, it could be earlier. Well, that's all confusing to try and keep track of. So if you go onto the preventive care website, it'll show you exactly what's covered, by age, by gender. So, and also for your children. So it's a great website that you can go to, and you can access it through the portal, but also at uhcpreventivecare.com. And you'll see here it also allows you, once you have your preventive checkup, to print the reports, download them, email them to your doctor. So if there's any question when you're going in, and this is back where I make the recommendation, and this happens quite a bit, is when you go in for your preventive care, if your knee's hurting, and I know it seems like we should tell them everything's wrong with us when we're there for our checkup, but leave it at preventive care, because the minute they start diagnosing something else beyond those tests, they could charge you a copay, and we run into it quite a bit. So my advice is to keep it free, stick to the list, And if you have other issues, then just schedule a separate appointment. Or if you want to do it all in one, you might just owe a copay. So it goes away from being free. So I'm going to give you some examples of care. So if I'm a patient, I have a sinus infection. With the plan that you have, you actually can access care 5 different ways. So United Healthcare and any of the carriers, but United Healthcare especially, has set it up where you have access to care 24/7. If we go back 5, 10 years, your choices were pretty much, I call my doctor, I see them Monday to Friday, or I go to the emergency room. Well, care has developed, we're busy, we're going, we want to make sure that it's most efficient. So for a sinus infection, we have the first choice is option 1. Through United Healthcare, you have access to virtual visits for $10 copay. So you can access this through the website, and you can actually see the doctor and talk to the doctor. And if they need to prescribe medication, they can do that and send it in for you. So for a simple $10, if you're on the high deductible plan, legally they can't do it for $10, so the max charge is $49. But all the other 3 plans are $10. I've used this for myself, for my family. I'm extremely busy. I travel quite often. 2 years ago I was in 25 states. This year it's like 16. So I'm not, and I just don't have patience to go sit for like 2 hours in a doctor's office and share germs with a bunch of people. So as much as I can do through a virtual visit at my desk at work is very nice, or from a hotel room. We were traveling on vacation. My son had pink eye. As a mom, I knew what it was. I didn't need to go see somebody. So I called in, and I called in, had the visit. Mine wasn't through UHC. It was through a different provider, but same concept. Called in. 20 minutes later, the doctor called me, called a prescription in, went down to Walgreens down the street from the hotel, picked it up, and within an hour, we were back on track, going on vacation, and I didn't have to worry about it. So it's a great option, especially if you're online through a webcast. Even say if you have a rash, you can actually show that to them and have prescriptions prescribed for, antibiotic cream or whatever it might be. So it's not for if you fell and hurt your back and you're looking for pain medication. They cannot prescribe narcotics. They cannot subscribe anything that's considered to be addictive. So my son, he's not here, but he does take ADHD medicine. And you would think that he could call in for a refill, and he can't because he has to physically see somebody. So those are certain cases where you can't do it on a virtual visit. But for all the basic things, UTIs, sinus infection, cold, it's a great service. Or even getting a second opinion of, okay, should I go to the doctor? Should I go to urgent care? Or can you help me? So it's nice to have that direction so that you're not out there trying to find care on your own. The second option, so I still have the same sinus infection, but I don't want to do the virtual visit. Maybe I think I need a steroid shot. So I could look at going to MinuteClinic or something similar. So MinuteClinic, Kroger, Target, they're all starting to have on-site clinics. Here you don't see an actual board-certified physician. You see a nurse, but they can still help with if you think you have strep or your child that has strep, because how many times it's Sunday night and maybe your kid has strep and I can't send them to school if they're sick, but if they have antibiotics for 24 hours, they can go to school and I can go to work. So then you would go to MinuteClinic. And their copays are the same as option 3, so they match up to your medical plans. So the third option, same condition, but now I'm going to go to my primary care doctor, make sure everything is okay, that I don't have anything more complicated, and other than the high deductible plan, which remember is no copays, here you would pay your copay based on the plan that you're on. So that primary, the new plan, the Primary Advantage, it would be a $30 copay, and you can go see your doctor. Option 4, it's the weekend. Don't want to go to MinuteClinic. I think I need some more care than what they can give me on virtual visit. So then I can go to urgent care, $50 copay. Again, not on the high deductible plan because there's no copays in the beginning, it's all deductible. But now I can go to urgent care. So like my urgent care, for example, does a steroid shot. So if I think that I'm at the point that I let it go too long and I just really need something more than a prescription, I can go to urgent care. The last option, and the most expensive option, because now you're getting into thousands of dollars, is going to the emergency room. And you'd be surprised how many people go to the emergency room for this same condition. had to take my daughter 2 years ago for a MRI on the weekend at Children's Hospital, but they send you through the emergency room just to get there. You have to sign in there. And she's like, "Oh, you're on the wrong side. You're on the sniffle side." I'm like, "What do you mean, the sniffle side?" She's like, "Oh, this is where people come with colds." I'm like, they're not supposed to be doing that. And she's like, "I know." And I just work in the business, so I know the cost and the time and the energy is emergency room for basic care. It's not a doctor's office. Unless you think you're going to die from your sinus infection, option 1 to 4 is going to be a much better option for you, time-wise, cost-wise, and honestly, the care is going to be the same, if not better, and quicker. So now you've decided with your sinus infection where you're going to go. The next part likely would be they give you an antibiotic or some kind of medication. So based on the plan that you're on, you have copays for every single plan. I've talked about in the past, if you want to save money, then when you have whatever your prescription is, go to your phone and you have GoodRx. So I do this for everything. You have a copay, but legally for your $15 generic copay, if it's only a $7 prescription, they can keep the change and charge you $15. And I'm sure all of you can find a way to spend $8 better than giving it to the pharmacy. So one of the ways to do it is through GoodRx. So I'm going to go on, and I keep my history. So let's see. The one prescription that I take, and actually the price keeps going down because I used to pay $35 for it, and now at Kroger, and what's nice is it'll pick up the zip code here and tell me where I can go. It's $8.93. So I know the lowest cost. So even if I don't have insurance, you have anybody has access to this. So I would just click on Kroger, click on, you can email the coupon, and I've done this for my son at college when I knew it was cheaper for him to do it this way. And then I can text him the coupon or I can email the coupon, but then I just show that to Kroger. But if you want an interesting study of how much prescriptions cost, at night, how many of you see commercials for like 6 commercials every night? You could diagnose yourself with like 5 conditions by the time you go to bed. So one of them is Humira. You'll see commercials for that. Currently, Humira costs $4,976 a month. If you're taking Harvoni, which is another one that you'll see at night, $24,104 a month. So it's just interesting at night. If you have this app, one night I got up to $72,000 a month if I had gone in and asked for all those drugs. So I just find it interesting. And people say, why is healthcare going up? Let me show you. This right now, last year was the very first year in the history of the United States where out of every dollar spent, pharmaceutical now is the highest cost. So they're trying to work on it. They're trying to do cost savings. They're trying to be more transparent with it. But all the new drugs, if it's on TV, it's not a generic. I'll tell you right now, it's not going to be 15. Someone has to pay for those commercials. I mean, here's another one. Vialar is $1,200 a month. So it's a good tool if you want to know. Or if you're on a drug and you're like, man, my copay's high. Is just take a look to see what, if you didn't have insurance, what you'd really be paying. But it is a great tool to use from an education standpoint and to maximize your pharmacy. If you're on, say, an $85 prescription, and it all goes by tiers, so you have generic and then preferred, non-preferred, the book that shows you where all your drugs fall is called the formulary, and that's on HR Connection. So you use GoodRx, you look at those. You also can go to Walmart. It has over 300 drugs on their list that are $3 a month. If one of your drugs is on there for $3, then keep your insurance card in your pocket and pay the $3, because again, they can keep the change. And how many of you live by a Publix? Yeah, Publix does antibiotics for free because they're trying to get you as a customer, so you can even get it free. So there's certain one. So check with a. So, yeah, they typically like to do the first one because they're trying to get you in, but they do advertise that they're free. So they're all just little tips. They're all tips that I use in my everyday. I'm very frugal when it comes to the healthcare dollars, and having 4 kids, it gets expensive. So it's really being an advocate, asking questions, and being informed. Here's a virtual visit, so no driving, no waiting rooms. It's $10. Have you tried them? How many people have tried them? Yeah, great. It's just yeah. So then the next piece, so it shows where you can access it right through the website, or you can access it through your Health for Me app through United. So you can even do it over your phone. So it's a very nice service to have. Talks about pharmacy. So if you go on to the United Healthcare website, they'll walk you through pharmacy. You can compare tiers. If you're on an expensive drug, the one that I suggest that you talk to is a pharmacist. They're really schooled in the differences of the drugs and if there's a generic equivalent. I tell the story that my dad years ago, sadly he passed away in December, but he was on many prescriptions for his Parkinson's. And one of them, a new one, my mom came to me and said, we're on a fixed income and I pay for Dad's medications the best that I can, but this one seems really expensive for what it's doing. It's $150 a month. Could you look into it for me? So I went to Rite Aid with her the next time she went, and I just asked, is there a different kind he could take? He's like, yeah, there's a liquid version versus a pill version, and the liquid version just doesn't taste that great. Well, it was $5 versus $150 a month, so it was like, well, Dad doesn't really taste much anyway, so, and even if it was me, I would take the yucky $5 medicine for $145 savings a month. So all that information's online. Also, say if you take a couple prescriptions, you really have to be careful in this day and age to not have drug interactions. And so if you want to call in and you can give them your drugs, they'll tell you any potential side effects or interactions. Because some of the emergency room visits that I run into with clients is, it wasn't that they were sick per se, it was a drug interaction because they were taking 2 or 3 things and they were interacting. But also the pharmacist can tell you that, and the pharmacist can educate you on different options that are out there. Okay, one of the changes this year with United is, many of you have been to my sessions in the past, is I've talked about being a wise consumer and asking questions that would be less expensive to go to a freestanding facility instead of going to the hospital. So if you need an MRI, there are facilities out there that do cash MRIs for like $3.99, or they'll do a discounted rate, but they're always less expensive than the hospital. So United must have been listening to me because they changed all their plans just exactly how I have been saying for years. So now what they do, and it's in the summary under lab work and major tests, is depending on the plan that you're on. So for example, on the high deductible health plan, you pay 10% less coinsurance for your tests if you go to a freestanding facility. So they're giving you save money by going. If you are on the $5,000 copay for some of your lab work, they'll actually pay for it in full if you don't go to the hospital. But if you do go to the hospital, then you're going to have coinsurance. Same with big tests like an MRI and CT scan. That's always forever applied to deductible. But they've added now where they won't charge you a deductible if you go to the freestanding facility. If you go to the hospital, there's an extra copay. So because there's so many different scenarios of when this can happen, and I don't want to bore you to death, is you just go through and look. And so it shows right on here, lab tests, outpatient. If I'm on the HSA plan, I save 10% if I go to a freestanding facility. On the 5,000 copay plan, if you go to outpatient and you need lab work, you pay nothing for services provided at a freestanding lab, freestanding diagnostic center, or in your physician's office. Your deductible does not apply. So they're really giving you incentive to be a better consumer, pay attention. Once you pick your plan, print it out so you know where it's at, because they put it in alphabetical order. There is another summary they have legally to give out called the Summary of Benefits and Coverage, but it's confusing to read. These are the best ones to read, and you go right through and it'll tell you exactly what you need in alphabetical order and what the costs would be. So this is one change that United has done for 2019. Each of the plans, again, the 2000 copay plan talks about free versus cost share. And this would be for lab work, x-rays, CT scans, PET scans, MRIs. So you just stop, pause, think, okay, I need a major test or lab work. If it's preventive care, it'll be covered already. But if it's something outside of that, they're working to diagnose a condition, just look at your summary or reach out to us and we can help you in making sure you find the best place for care. Now I'm going to give you an example if you're in the hospital. Hospital visits are expensive. So $30,000 actually in my example is pretty low, but I'm giving that just to give you an idea if you had a $30,000 hospital bill. If you are on the high deductible plan, I'm going to go through all of them, but whenever a hospital stay occurs, you're always going to have a deductible. It'll range depending on the plan that you have. There's also co-insurance depending on the plan, and the new per occurrence copays that United has. So there's 3 different scenarios where costs could kick in. So I did the math on a $30,000 claim. If you're on the high deductible plan, you would pay your $4,000 deductible, then you pay co-insurance, and there's a $500 per occurrence copay. So your estimated out-of-pocket potentially, and these are estimates, I'm not the claims department, I'm just trying to give you an idea, is about $6,500. But that's one of those worst case scenarios when everything's gone wrong and you're in the hospital. But that's like your worst case scenario for you as an employee or for one of your dependents. Now if I had that same exact procedure and I was in the hospital, the Primary Advantage plan, that would be a $3,000 deductible. Plus they don't have co-insurance, it just has an additional $1,000 per occurrence deductible. So your approximate out-of-pocket for that same hospital stay would be $4,000. Then we're going to go to the traditional copay plan. So this is where I want you to think. If you're on the $5,000 plan now, it actually will cost you less for hospital stay when you look at the structure of it, but you're giving up your copay on specialist and your copay on emergency room. So it's just weighing those two sides of what's more important to you. Is that would be your $3,000 deductible, or hey, your $5,000 deductible. I typed it wrong, so sorry. I'll fix it for the next. So $5,000 deductible, 30% co-insurance. Either way, whether it was 3 or 5, you're going to hit your out-of-pocket max. And on that plan, it's $7,000. Traditional copay of $2,000, you would pay your deductible, 1 per occurrence copay of $500, and that surgery or hospital stay would be $2,500. So the best plan would be your lowest cost, but you also pay for that. So you look at premium versus what your out-of-pocket is. And the way that I look at any health plan is I assess on the health plan what my worst case scenario is, and then how much do I go, like what time of care. But then I also am going to do the math. So say if I'm looking at the high deductible plan versus that 2000 copay plan, well, it's $120 extra a paycheck or extra per month. That's like $1,500. I personally would rather keep the dollars in my pocket and then pay when I get sick. Or if you know you're having a surgery, or potentially we do the 2000 plan a lot for those having babies, because then you have a fixed cost because that's more expensive. Is just doing the math between each tier and deciding what your risk level is, like how much am I willing to risk in lieu of having a savings. Some of the value added. Now this is where I'm going to get into the handouts, but before I go into the next section, I've gone over samples of how pharmacy works, how doctor's office works, and how hospitalizations work, and testing. All the major stuff. Any questions? What's your current plan? Oh, well, because all the letters changed. I don't know the letters off the top of my head. Does it have anything else other than that? The base plan, it's a 5,000 plan. So ARWS, if it says base plan currently, that would be the 5,000 plan. The buy-up plan would be the 2,000 copay plan. And then the HSA would say HDHP, HSA. The reason we changed the titles is now that there's two lower cost plans, it's sort of hard to call the 5,000 a base plan because I have two plans cheaper. So it didn't make sense in the build out, but that's what that plan would be. Yeah. So if you didn't, she was asking the current summaries you have in front of you. United changed, when they changed their certificates of coverage this year, it changed all the little letters on the plan, which also would trigger new ID cards as well. Any other questions? Yes. It won't, because those are your current elections. That's currently what's coming out of your check. And then what's on the handout is what you will be paying in 2019. So we showed you current because we don't know what your elections will be. So then once it's completed, then you'll get an updated report. Any other questions on the medical plans? Yes. I'll go over that at the end of how to do the form. Any other questions on medical? Going once, going twice. And I'm here all day, so if you have other questions, because healthcare is extremely complicated, so I do my best to make it simple, but it's a very tough subject to make simple. All right, dental and vision. So that's the next thing in your summary. We're moving to Humana. Humana purchased a dental vision company a few years ago. I actually have to say it's one of my favorite. So upgrades that you get this year on dental. Currently, you receive a $1,000 benefit per year for your dental plan. With Humana, as of January 1st, that'll go up to $1,500. The $1,500 does not include preventive visits, so you get 2 cleanings a year, plus $1,500 towards any fillings, things of that nature. It also will cover implants, which is new. And then they have something called the Max Rider that in it is even once you hit your $1,500, they'll continue to pay 30% of the cost with no cap. So say if you have a year you need $10,000 in dental work, you actually on the plan you were on with United, you'd be done at $1,000, done. Here it's $1,500 plus preventive, plus 30% of the remainder, which could end up to be a few $1,000s. So it's a really great plan. You have in and out of network coverage. The links are online to search the provider directory. Dentists are another one that a lot don't want to get into dealing with claims, so they might not be in the network, but what's nice is you can still go there. You just might be balance billed at the end because they don't have a contracted rate. So when you call the dentist, does anyone remember from years past of what question you ask? Come on, guys. Not one of you. Are you in my network? Not, do you take my insurance? Because they'll all say, sure, we'll file that claim for you. That does not mean they are in network. So you really want to say, are you in network? Because by being in network, then you're paying the lowest cost that you can. And if you need major service, like my son needs his wisdom teeth out, they send it in to get a pre-estimate and send it to me, and I know what I'm paying going into it. So you really want to ask questions. Yes? With any change, it's potential. If for some reason they're not, you can nominate your dentist, and Humana will reach out to them to try and get a contract in place, or let us know, and then we'll communicate that. But with any change, whether it was medical, dental, vision, there's never a guarantee, but you don't have to stop going to that dentist. You might just pay out of network. So like I have a dentist I really like. A few years ago, my husband went to get a cleaning, and they said they wanted to do a periodontal cleaning, and came back in and told him it'd be $700. And he's like, I better call my wife, because she does this for a living, and she would shoot me if I spent $700. So he called me, and I said, say thank you, but no, because we went to that dentist, and they were out of network, and that's fine, because I made that choice, because for our cleanings, we like them. But I then called a periodontist that was in network, and that same exact cleaning was $240. But you just stop for a second and say, you know, don't feel pressured. Say, hey, I need to look into this. It's a lot of money. And then just make sure that you're getting the best dollar. I mean, because the cleaning is a cleaning. He didn't feel any different. But had he not stopped and asked that question, it would have been, one, a lot of money. Two, I would not have been happy when he got home. So again, you get the dental max up to $1,500 versus $1,000. Your preventive care pays outside of that $1,500. You have the implant coverage and the summaries for the dental. We actually gave you the summary inside of here. So you have the dental, and it goes through what's considered basic, what's considered major. There is a small deductible on major services. And then this also covered having composite fillings, because sometimes they'll want to do silver because the white composite's not covered, and this actually has some coverage for that as well. So it's a much better dental plan. If you're currently on the United Dental plan and you have quite a bit of work need to be done, you could finish up using your $1,000 this year, and then your $1,500 will trigger new as of January 1st. Okay? Any questions on dental? Yes. It is percentage-wise, but on the so say if it's 80%, but if the contracted rate for a root canal is $600 and you pay 20%, but if that out-of-network dentist charges $1,000, then your percentage is the same, but you would then owe more because he's charging a higher rate for that root canal to a contracted rate. So they have a fee schedule that they have to adhere to, and they cannot balance bill you. The only time I see balance bill in network is maybe they did extra fluoride or something that wasn't covered as an adult. That's typically what I see. Or they did extra x-rays that were covered beyond the plan max. But no, you should not be getting balance billed. You should be paying exactly as outlined. Yes? I have to get back to you on that one. I'm doing so many clients right now that the one last night was, I'm not sure. That's not you guys. I'm thinking possibly, but let me double check because each of the carriers, and that's her question was, is there any rollover benefit? Is some of the carriers have a max rollover? If you do your preventive, then they give you a little bit extra moving forward. And I have the detailed policy over at the table, and I just have to double check. So I will update that at the second meeting and then have Elizabeth let everyone know. All right, any more dental questions? The website's online so you can look for dentists, or sometimes if the website's not most up to date, always calling your provider and asking the questions of, are they in network, not just, do you take my insurance? All right, so vision. How many of you wear contacts or glasses? So nice feature here is with the vision plan, so it's a better vision plan in the fact that they have pretty much copay set for every level. So instead of having to pay a percentage, you have a copay for your lenses, a copay for whether they're bifocal, a copay for scratch resistant. So it's much easier to determine what your cost is. And also the upgraded feature is before you could only get your lenses for your glasses once every 2 years and then the contacts. Now you can get your lenses and your contacts both every single year. So that's like a huge upgrade because that's a few $100s. And for your convenience, as shown on the handout, is you can go onto the Fancy Dancy Technology Glass website and do that where you put your picture and try on the glasses, and then you can order your frames right online. So you have to get your exam at your providers, but if you want to use your benefit, you can use your benefit at glasses.com. Or if you wear contacts, you can do contacts through Contacts Direct and use your benefit to order your contacts online, so you don't have to go to go through that whole process at the provider's office. You still need to get your exam, but typically you'll run out of contacts before the next exam is up, and all of this will kick in January 1st. So it's a great vision plan. It's a brand new offering where they're doing the contacts and lenses for your glasses every year, and then your frames are still every other year. But the lens is what you can upgrade. So both of these pieces are in there. You'll get your information ID cards in the mail at the end of December. Great technology from the glasses.com website, and great upgrades on the benefit, $10 exam. They do have a benefit for retinal imaging, and I've been up since 5 a.m., and so can you edit that from the video, please? Because now I'm going to be known. Okay. Don't make me laugh. Because once I start laughing, I won't stop. So, yeah. Oh, well, I entertain you guys every year one way or another. All right. So, a couple other value-added benefits that you have through, and the network example is you always have local practitioners on the vision side, but Pearl Vision, Pennies, Target Optical, they also take the Humana coverage. Other value added is if you're looking to lose weight with United, you can sign up for Real Appeal. It's free to members. You get a scale, you get videos, you get the weight scale and weighing yourself scale, you get a NutriBlend blender. It's almost $300 in, not gifts, but incentives to work to lose weight, and they assign you a coach. So you can go online to request that. Then this year, I had added in a wellness program called Rally. You have the flyer inside your packet. You can earn up to $240 in wellness dollars, and it gives you all the directions on how you do that. We did change a carrier for the life insurance this year, and with that, you get employee assistance program, so you get up to 3 visits per condition. They also have help or assistance with anything, stress, financial questions, death of a family member. And then they also have a service called Medical Bill Saver, where if you do get billed, we're always here, and Snow is the one that your account manager, if you haven't met her in person, she's amazing. She's over to my right. And then my technology person, Chris, is here today with me. And they also will work to help you negotiate a bill, explain a bill. So it's an additional service on top of what we already offer. So those are great services, and that's why we highlighted them inside the packet. So you have the Health Advocate Service flyer, you have the EAP, and actually they do anything at EP. It's 24/7, 365 days a year. Actually, a few years ago, it's probably like 10 now, I had someone call in to get directions on how to make their turkey because they had never made one before. So they even help you on Thanksgiving if you're in a pinch and you're not quite sure what to do. So all of the information's here about the wellness programs. I have 9 minutes left. So we went over dental and vision. Now it's time to enroll. Okay. So the new thing that we'll have this year is the life insurance. I know it's not an exciting benefit, but it is something that we all need to plan for our family in the future. We're moving to Unum this year, so you still have your employer paid life insurance, but then for you as an individual, you can purchase life insurance. For this enrollment only, if you have not participated before, I strongly encourage you to look at it because it's guaranteed issue. So what that means is no medical questions, up to $100,000 in coverage, and you just sign up. No physicals, no height, weight questions, no health questions. If you have a health history, now's the time to look at it. I was diagnosed in 2012 with a genetic condition which made me uninsurable. That if there's a program like this is where I take advantage of it because I could not go to the open market and get approved for life insurance. So it's a great offering. The other nice thing with it is, say if you're like, okay, I'm young, I don't need a lot of life insurance. If you purchase in during this enrollment for $10,000, which is minimal, it's less than $1 when you're in your 20s. And then 5 years down the road, you need more because maybe you had kids and life has changed and you got married or maybe you got sick. You can upgrade once a year at open enrollment on this plan with no medical questions asked, as long as you enrolled to start now. And that's a great feature. I've had people, a few years ago, a wife came in with one of the churches that we insure, and her husband had Lou Gehrig's disease. And sadly, if you know that condition, there's no cure. And she was able to purchase life insurance for him. He died 9 months later, and that wasn't her plan to get rich. She just wanted something to help pay for a suitable service and to help with her children. So life insurance, when it's guaranteed issue, is a great benefit. If you currently have it, and we'll go over how you can say I want to keep it, but if you don't, so say if under the group voluntary life you had waived, if you want to purchase it, you can just write it on there or meet with us and we'll run you a price. So that is highlighted on here, but I would definitely look at that if you haven't done it before. So now to the enrollment summary. You'd asked how this is going to work. So we try to make it easy for you. 2 things. Moving forward in 2019, the benefit enrollment is going to now be an ADP, part of your payroll system. We've built it out, and we're in the testing phase right now, so we're not opening it to all of you. So we ask you, don't go in there and play around. Let us break it first, and because if we break it, we can fix it. So there's 4 ways to enroll. So you can today look at your summary and look at it. And if you're on the base plan, which I told you, ARWS is a 5,000 plan. Okay, I want to keep that. I'm not going to change it. The dental plan, I want employee only, but it's going to move to Humana. Vision, employee only, it's going to move to Humana. I don't have an HSA, so I'm not going to put money away. And for anyone who's on the high deductible plan, after open enrollment's done, we'll have a webcast training on how to and why you would want to put money away into health savings account. But we're not going to take time to do that today. So voluntary life, if I had it before, yes, I'm going to keep it, or no, I don't want it, or I want to add it. Allstate, if you still want to look at Allstate, we can quote it through our call center, but it's not something that we're enrolling today. If you've had it before, it'll just stay in place and you let us know. But you can check the box at the bottom. So read the paragraph, check the box. I'll take all the same plans, the same benefit type plans, no changes. Or if you want to make a change, write all over it, tell us what you want your change and turn it in. Or meet with us. Or call our call center and enroll through our call center. Or meet with Elizabeth. So there's 4 different ways, and we really tried to make it easy. And then next year, you'll have to do your own enrollment in ADP. So we're here all afternoon, so you can turn it in. And if you have questions, we can run rates for you. We can also give you different scenarios between the plans and helping you to select what plan works for you. If you want to do a little bit more education, go on to HR Connection. There's videos out there. There's more information. They're the plan summaries if you want to look at them. There's the compare tool that's in there that you can compare the plans. And then a lot of you have addresses that change, so we'd really like to make sure going into W-2 season that the correct address is on file. So write your new address here, and we'll update that in the system for you. So anything you need to tell us on here, you can do. And please print clearly so that we can read it. So if you scribble in cursive, and I know they don't teach cursive anymore, but I can't read it. And if you make the address so I can't read it, then likely you're not going to get your ID cards because I can't read it. And if you have an apartment number, make sure you put that on there so that the mail delivery, they don't forward ID cards, just from a security standpoint. So you will be getting all new cards from United. You'll be getting cards from Humana for vision and for dental. So watch your mailbox the end of December. The elections are due by November 30th. So we ask that we've given you 2.5 weeks to 2 weeks to get it done. Like I said, HR Connection has a host of forms. There's also an open enrollment page. There's United Healthcare Resources. And I have 4 minutes left of my hour. Any questions? Did you learn something new today, I hope? All right, and in true fashion and like tradition, because it's harder every year. So this year we're like happy, smiley ones. So there's all different ones in there. So you can come up and pick out your stress ball. You're the only client, just so you know, that I do stress balls for. And it is stressful for me because there are not a lot out there, so I have to search. And then I also put the little smiley face emoji on your handout. So there is one in here with glasses. So, there's a question. Yes. Yes. So the question was, can you take your life insurance with you? You would contact Unum. There's a conversion, and they would convert it over to an individual policy. So you would work directly with them to convert it over, and then they send you a letter outlining the detail, the costs, and how it works. Any other questions? All right, I am here afterwards. If you have questions, you can turn in your forms. And thank you very much. I appreciate your time.